Hello, and welcome to this tutorial designed to guide you in performing an optimal total body skin examination. This video is being recorded during the COVID-19 pandemic, so you will notice we are all masked for everyone's safety. I'm going to take my mask off at this time as I am socially distanced from all of my colleagues. The total body skin exam can be beneficial in identifying melanomas and other abnormal skin lesions. Every comprehensive exam provides the clinician an opportunity to assess the largest organ of the body, the skin. To prepare for the total body skin exam, you should have adequate lighting, a ruler or tape measure, and a magnifying glass. These tools will help you visualize and describe important features of skin lesions such as the size, shape, color, and texture. Some clinicians may also use a handheld device called a dermoscope. This tool can help visualize patterns of pigmentation or vascular structures. With adequate training, it can improve the sensitivity and specificity of differentiating melanomas from benign lesions. However, the dermoscope is not essential to completing a total body skin exam. As we go through the examination, we will note any abnormal skin findings, and at the end of the exam, we will describe these lesions and demonstrate how to document the findings. The total body skin exam will be performed with the patient sitting on the exam table facing the clinician. The clinician will be standing to begin the examination. This is not a lengthy exam, and our sequence is to optimize the comprehensiveness while showing that very little time is required. Now let's go meet our patient and begin our exam.
Good morning, Mrs. Williams. I'm Dr. Lisa Owsley, the nurse practitioner, and I'll be doing your total body skin exam today.
Good morning.
Start by examining the hair and scalp. Separate the hair and examine the scalp from one side to the other. You may need to use your fingers to separate the hair to see the scalp. Note the distribution, the texture, and the quantity of the hair. Now inspect the head, including the forehead, ears. Pay specific attention to the helix and the back of the ears. Look at the eyes, including the eyelids, the conjunctiva, the sclera, eyelashes, and eyebrows. Look at the nose, the cheeks, the lips, and the mucosa of the oral cavity, and then the chin.
Lift your tongue up. Thank you.
Next, examine the anterior neck.
It's fine.
Now inspect the left shoulder, the dorsal left arm, the hand, the fingers, and inspect and palpate the fingernails. Note the color, shape, and any lesions. Please note longitudinal bands of pigment are normal in people with darker skin. Inspect ventral left arm, left axilla, and then the left flank. Next, inspect the right flank, right axilla, and the ventral right arm. Next, inspect the right shoulder, the dorsal right arm, the hand, fingers, and inspect and palpate the fingernails, noting the color, shape, and any lesions. Note an abnormal dark lesion is identified on the upper deltoid area. We will return to examine, measure, and document the lesion after the total body skin exam is complete. Next, inspect the anterolateral, left leg, and plantar foot. Inspect the toes and in between each toe and sole. Next, inspect and palpate each toenail. Next, inspect the anteromedial left leg, and then move to the anterior medial right leg. Next, examine the right plantar foot. Again, between each toe and sole. Inspect and palpate the toenails. And then inspect the anterolateral right leg. Next, we're going to inspect the groin. In a female, we would be inspecting the mons pubis, the labia, and the perineum. In males, we want to inspect the skin on the ventral and dorsal surfaces of the base of the penis and scrotal area, as well as the corona and urethral meatus. For the first part of the exam, the patient has been on the exam table facing the clinician. Now we're going to have her stand with her back to the clinician. We're going to inspect the occipital scalp and posterior neck. We will then inspect the upper back. This is a common area that patients have a difficult time or are unable to examine. Now we're going to inspect the back of the right arm, and then the left arm. Then moving to the center and then lower back. Then inspect the back of the right leg. Inspect the back of the left leg. And end the examination by inspecting the buttocks, including the intergluteal cleft. Now let's go back to that lesion and describe it and review the appropriate documentation. There are several components that need to be included when documenting a skin lesion. These include number, size, color, shape, texture, the type of lesion, being primary or secondary, and the location. This lesion is singular. Its size measures 1.9 centimeters width by 2.2 centimeters in length and 0.2 centimeters in height. The color varies in black, red, and brown. Its shape is irregular, asymmetrical. The texture is firm and dry. This is a primary lesion, and it has a papular morphology. Its location is on the upper right deltoid. So this would be documented as a solitary 1.9 centimeter width by 2.2 centimeter length by 0.2 centimeter height, irregular papular lesion, varies in black, red, and brown, located on the right upper arm. The total body skin exam requires very little time to perform. By optimizing the sequence of the exam, the clinician is both thorough and efficient. It is our aim that optimizing the total body skin exam instructional video be used by students and faculty as a tool to enhance education and curriculum. Although this tool was created through the ETSU College of Nursing, it was our intention that it be shared across any healthcare disciplines.